Call Village of North Fond du Lac Board of Trustees meeting to order Monday, January 20th. Audience members are requested to sign in on the sheet provided at the registration table. Citizens wishing to be heard on topics not listed on the agenda may speak under item C. Citizens may be given an opportunity to speak under or during discussion of items listed on the agenda and are allowed 3 minutes for comments. Disruptive discussion or profanity will not be allowed. Roll call of officers.
Morning.
Here.
Price.
Here.
Streeter.
Here.
Stutz.
Here.
Will.
Stand for the pledge.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Citizen participation. Citizens are to address the board only. Statements are to be limited to 3 minutes. The board may not respond to items not listed on the agenda. However, you may ask for an item to be placed on future agendas. Any citizens wishing to be heard? Seeing none, moving down to announcements. Any announcements? Seeing none, moving down to President's business. Do you have something for the library? Nick?
Yep. So Heather had to cover the library tonight, so she couldn't make it. She mentioned that along with the year-end paperwork, she is working on sending out another batch of the yearbooks from Horace Mann to get digitized. And also, they've been working on weeding out their collection before they begin working on the annual report, so getting rid of some of their stock. So that's all she had.
Nice, thank you. Lakeside Municipal Court. Todd?
The judge has been on a legislative committee through the Judges Association, and they've been working on a bill that basically is to streamline the court process. And they've been working on it for over 2 years now. And with the help of Representative Thiesfeld, they were able to move it forward with bipartisan support all the way through. And tomorrow he will be in Madison for the formal signing of that. It's basically, like I said, streamlining through the court process.
Nice. Is that it?
That's all I have. Yep.
Yeah, and then Jeremy Thiesfeld's newsletter, he also gave a shout out to our municipal court for how well they do. So, just so, I don't know if you knew that or not, but.
I did see that, yeah.
Okay.
Yep,
Okay,
thanks.
good. All right, Administrator Nick.
Thank you. Continue to work on IT upgrades. We got a server that needs to be upgraded along with several PCs, along with software on several PCs that need to be replaced towards the beginning of this year, sooner than later. Attended OSG Executive Committee meeting on Thursday of last week. We are working on renegotiating, but not really, the OSG contract from year 2000. So 2020 is the first year it was kind of open to be renegotiated. We're not necessarily renegotiating the entire contract, but we are, the city would like to tweak a few areas of that. So we had a lot of discussion with OSG about that, and it mainly pertains to Clearwater elimination and how we charge for that and how we spend that money on our systems to get rid of Clearwater. Chris and staff up front have been working a lot on completing the W-2s and 1099s for all the vendors at the year end here. The W-2s went out to all the employees last week, and everybody should have those now, and the 1099s are going out this week. We're just kind of reviewing all of those to make sure we've got the right ones. I also have been in contact for the last several months with our Verizon representative for our government account for our cell phones and pucks and all that for the police department, and trying to come up with, you know, as those plans change and as the usage change, we try to, you got to move with those plans. So got to jockey around a few individual phones and that, and so we're trying to get that ironed out, and it looks like we'll be saving a few dollars that way. So other than that, it's just kind of starting the new year and getting all the loose ends tied up from last year. So that's all I have.
Thank you. Police Department. Derek?
Thank you. I'm going to start by passing around some packets. There's a monthly report for November, monthly report for December, and then an annual report for 2019. It's the same report that you see each month, so just numbers and a little bit of data that way. The only other thing that I have is we have I received notice today that we were approved for a $4,000 Bureau of Traffic Safety Equipment Grant. So we have been approved to go ahead. We're going to be purchasing another of the solar-powered speed display boards. Obviously, they're a great tool in like the school zones out by the park. And this new one that we're getting will also have the ability to do data collection. So can help with traffic patterns, which could obviously be useful for DPW as well as the police department. So that's all I have.
Question about you have an existing solar one, correct?
Correct.
And is that performed quite, I mean, have you had any
It
issues with
performs really well. That one does not have the data collection
Right, but
capabilities, but
I don't remember ever hearing of any problems with it. It seems
none
to-
whatsoever.
okay.
I think when we first got it, it was not maintaining the charge throughout the entire day, but Public Works went out and repositioned the solar panel on it, and there hasn't been an issue since, so.
One battery.
I'm sorry, what was it?
Replace the battery once.
Oh, okay, all right.
Good.
Thanks, Darren. Fire EMS, Jake?
Thank you. Tonight, crews will be out in Lambertine. There's a mock snowmobile accident. So Lambertine Fire Department set up a training with a couple other agencies in the area to mock a 2 snowmobile accident. So they'll be out there doing that tonight. I've been working with Captain Scott Kraus from City PD to set up an alert training, which is for active shooter response, so that we're kind of integrated with law enforcement when we respond to those incidents. And tonight we have LifeQuest here, Tim and Lizzie, and we'll obviously get into that in a little bit, but that's all I have.
Thanks, Jake.
Yep.
All right, Public Works, Darren?
Thanks. Just a couple of things. Crew's been out plowing, and then we hauled snow from the downtown area around the municipal building here, and also cleared all the snow piles from where we plow courts to. With this last snow, we haven't hauled that yet. They're predicting snow this weekend, so we'll probably wait until early next week to haul again. Also had the crew out, we're doing some cutting in some of the waterways. Mosier Creek, we have a ditch out in the business park that's kind of all grown in with trees and brush and stuff. So we're working on those. Now that the ground is firming up a little bit, we're able to get in there and not have to wade through mud and stuff like that. And then I've been working along with Dave Ledowski, and we're clearing up some of the things that were brought to our attention in the sanitary survey that the Wisconsin DNR did last October. We have a deadline coming up with some of the things at the end of February. One of them is the ordinance that we'll be looking at tonight. And then there's a couple other things that will be coming to the board in the next couple of weeks.
And I saw that you guys are putting out a lot of the sidewalk notices.
Mhm.
So,
This snow shoveling notices.
so we just warn people once, right, and then after that,
Yep.
we just do it, like if it's not within 24 hours, is that correct?
Yeah, so the way it works is it's per season, not per year. So this winter season now, each address gets one warning, so to speak. But their warning is really just a letter saying you have till tomorrow morning to shovel it. If you don't shovel it, we're shoveling it for you. And then they get billed for the shoveling plus the fine. The next time, if they don't shovel, we keep record of those addresses. If that same address doesn't shovel, we go out and check it again. We don't have to give them another letter. We just go and shovel it. Does that explain?
Yep. Yeah.
And we have gone out, we've gone out once, and sometimes, depending on the weather patterns and blowing and drifting, technically, we're not supposed to go check them until 24 hours after it stops blowing and drifting or snowing. So, sometimes it's hard to get out. If it snows every other day, it's hard to get out there and actually mark them. But we did go through once and cleaned up quite a few of them. I think we kind of
14.
ran out, we had 17 or so that I think we only hung 17 hangers on the first time
Cleaned
out, so
14.
cleaned 14 of them, so,
Okay.
yep.
And I don't know if you guys were aware of Facebook post someone forwarded to me about, I don't know if it was between Clinton and Wisconsin and Mosier, where we cleaned out some trees, and someone
trees
was
and
kind of
brush
upset
there.
about that side. Just, if you're not aware of that, you probably will be. I don't know who the person was, but someone was venting about, replanting those trees that aren't supposed to be there, and they don't understand that. I mean, it's not us, it's the DNR that doesn't want those in the watershed, right?
waterway, right.
Yeah, so just so you're aware. All right, is that all you had, Darren?
Yes.
Okay. Consent agenda. Approve the minutes of the following board meeting from from the 6th of January of this year, and approve invoices and authorized checks to be drawn on the respective funds as indicated. General fund, $84,058.57. Library fund, $14,062.43. EMS fund, $4,226. Capital funds, $35,853.86. Water department, $8,042.38. Wastewater department, $13,214.25. Stormwater fund, $5,196.62. Community Development Authority TIF, $7,646.94 for a grand total of $172,301.05. And also approve the following operator license for Penny Schneider for Dollar General Permanent. What is the board's pleasure?
I'll make a motion to approve the consent agenda as read.
Can I get a second?
I'll second that.
Got a motion by Will, second by Stutz to approve the consent agenda as read. Are there any questions?
I have a question.
Ann?
It's on page 8, that, Titan Public Safety Solutions. Was that more than we thought it was going to be?
On page 8 of the invoice report?
Yeah.
On the top, page
Yeah.
8?
Yeah, sorry.
That's okay. I'm sorry, what was it?
It's $14,974.
What was it for? Titan Public Safety
Yeah, I think
Solutions.
it's for the municipal court. Maybe it's for their computer software maintenance contract.
Yeah. I don't know, I'll have to look into that. yeah.
Okay. I think it's quite a bit more than what
We
we
budgeted?
budgeted. Yeah. So I don't know if it was more than we thought it would be.
The only thing is
Not
that
sure if
billed
they
out?
They reallocate some of
Yeah,
it back
reallocated to
all
some of the other
all
districts.
members.
Oh, okay.
As well, yeah.
So maybe it'll get adjusted.
I think
or
that'll get
something.
adjusted.
Okay, thank you.
I'll look into it though.
Okay.
Any other questions? Anything? All right, seeing none, all in favor say aye.
Aye.
Opposed? None. Administrative, discussion and possible action on approving the following license application for the 2019-2020 license period beginning 1/29/2020. Station Prospect LLC, Matt Dillon, for that's combination Class A fermented malt beverage and intoxicating liquor license. Tobacco and cigarette products license for Station Prospect LLC, and non-intoxicating beverage licenses for Station Prospect LLC. And that's it. And that's the BP, right?
That's another, yeah, the BP on Prospect Avenue is changing ownership, and the effective date of that, the closing is the 29th of January. Yep.
What is the board's pleasure on this item?
I'll make a motion to approve the licenses.
All right, gotta get a second?
I'll second that motion.
All right, got a motion by Horning, second by Price to approve the licenses listed. Is there any questions on this item? Seeing none, all in favor say aye.
Aye.
Opposed? None. Ordinances, discussion and
You
possible.
missed number 2, page
On
1.
Oh, whoops, I'm sorry. Number 2, discussion and presentation on ambulance fees and billing by LifeQuest. Sorry about that.
Perfect. So I'll introduce Tim and Lizzie. We work quite a bit with both of them in regarding to EMS billing, and appreciate you guys coming out, and all the work that you guys do for our department.
No problem, no problem. Good evening. My name is Tim Rosini. I work with the Client Relations and Sales Department, and the Chief mentioned this is Lizzie Trotter. She is the project manager, excuse me, for the between the village and LifeQuest effectively. So if there's any questions from these guys or from the board, they definitely generally go through Lizzie, and she handles all of those things. So I know you have an ambitious schedule, so I'm gonna move through this so you're not long and drawn out. But I do wanna make sure I have some time to answer questions and things like that for you. So I just wanna kind of walk through just a little bit of a review of your business, and then kind of how some claims work. And then I think it kind of gives an idea. Oftentimes there's a lot of confusion in terms of the billing and these automatic write-offs and things like that. So if you have any questions, certainly just let me know. So this is the Medicare 2019 fee schedule. There is none released yet for 2020. This fee schedule tells us, Medicare pays us to, when we transport somebody, they pay us a base rate and mileage. So this is the list of the base rates. That zip code 54937 is at least one of the zip code here. We get paid, the village of North Fond du Lac gets paid from the point the patient is picked up. So from the point they're picked up to a covered destination. And assuming that the documentation supports that, it'll be billed at a covered service. Now, based on the level of care that's provided by the crews and what the medical record says, we have to plug in where do they, what level of care can we bill the programs for. SCT or specialty care, critical care is the highest level of reimbursement that you get, and so we get paid one of these base rates on a covered call, assuming the call meets medical necessity and document and reasonableness, and then we get paid for mileage, and we only get paid for the mileage that a patient is in the rig. So I just wanted to kind of walk through, and this is what Medicare allows us. These are the maximums that we get to collect, okay? And I'll just kind of show you how these write-offs work.
Tim,
So-
oh,
you bet.
not to interrupt you, is it possible that we could get a copy of this presentation
You
sent?
bet.
Okay.
Yep, I've already sent that to
Okay.
Chief, and
So
I'll,
we'll
you
get
bet.
that to the board members afterwards, if that way they got
Yeah.
these numbers. All right, thank you.
You bet. So I just took an example of an ALS medical run, Medicare run, because ALS is gonna be about 80% of the time that we bill for you as a covered service, we're gonna bill at this. So this is like a true depiction. Now, the ALS one rate that I have up there, $11.50, that is your non-resident rate. So if somebody passing through town uses your services, they're gonna get billed $11.50. Your residents are billed at $9.50, okay, just as a point of understanding. So just as an example, I use this ALS 1 emergency again because that's gonna be about 80% of the time, so I'm using that as our example. That's, again, generally gonna be the true depiction. So we bill $11.50, Medicare tells us we get $432.15. That is it for a base rate, that is its entirety. They pay 80% of that, or they're gonna send a check directly to the Village of Fond du Lac's bank account for $345.72. The patient's responsible for the other 20%, or $86.43. They have a supplement. If Medicare didn't cross it over, we will, but if they don't, we send that to them. But ultimately, the patient's responsible. Of course, those two together equal that $432. The interesting thing here is, and not so glamorous, is that on every single one of these Medicare calls, we have to adjust off $717.85, or 62% of your original charges. That is a federal mandated adjustment. We can't collect it, you can't collect it. If a patient says they want to pay that because you saved their life, we tell them, send a donation to the service. But if they say, no, I want this reflected on my account to show that I paid it, cannot do it. It has to be returned to the patient, okay? So in a Medicare call, again, you can see, and this is about 50% of the time, I think I have some numbers here on your demographics, but it's about 50% of the time, this is the true depiction of what plays out on a Medicare run. Wisconsin Medicaid is worse. Take a look at that. The federal government on an ALS run gives us $430. The state of Wisconsin gives us $180. We're one of two states in the union that have not had an increase in over 10 years. In fact, I think for Wisconsin, it's now been 12 years. We have not had a change in this schedule. The other state is Pennsylvania. But anyhow, in our example, we get $180. And these again are the allowable amounts. These are the maximums that we get to collect. We get to collect one base rate, and then of course the covered miles or the loaded miles, and that's at $556. So that same example, somebody comes through, a non-resident, we bill them $11.50. Medicaid pays $180.31. We're writing off $969, or 84% of every single Medicaid account that originally is billed as a covered service. If it's not covered, there's some paperwork that the crews obtain that allow us to balance bill those. But between these two, Medicare and Medicaid, you can see, and obviously when you're trying to make your budgets happen and purse strings meet, it's not such a gloom. There is no increase scheduled for Wisconsin MA, unfortunately, despite all of the lobbying. And from a Medicare standpoint, it is minimal. It's like 0.024, but it hasn't even been released yet for 2020. If they apply one, they go back and just pay for that. Did you have a question?
Can you bill, is there time when you can bill the state and the federal for the same call, or one or the other?
Well, if a patient has, like you asked, like if a patient has Medicare and Medicaid,
Yeah.
usually Medicare is going to be primary. So what happens if Medicare pays, the state doesn't even pay as much as they do, so the state doesn't pay anymore. Yeah. Does that answer your question? Yep, yep. So this is just an executive summary, just kind of a brief overview look at your 2018, 2019 business. You can see, highlighted in red, the gross revenue, right? So we're talking the money that LifeQuest collects for you. In 2018 was $265. That's cash. Our gross revenue was like cash that should have hit your bank. In 2019, they had a nice increase, I think in part, probably because of some of the interfacility business and such that you did. So very nice, but you can take a look at these mandatory adjustments. When we bill out $627,000, and we have to write off those scenarios that I just walked you through. So that would also include like VA and any of the workers' comps that are required. $246,000 mandatorily had to be wrote off. I mean, it's just really difficult in this business, right? We all know it's not a money-making gig by no means. In 2019, the year that just ended, we had to write off $275,000. Again, those are mandatory. Can't do anything about those types of things. Just a kind of brief look from a run count history going back all the way to 2012. you just take a look at those, and we have the service make sure that those are verified on a monthly basis, so we got.
I just have a question, because I'm the one putting together these budgets a lot of years, and over the years, we've kind of come up with this number of 46% uncollectible. And those two scenarios are 53 and 54% uncollectible. Have you seen a trend in the last 10 years of that? And
Yeah,
the
in
reason I
terms-
ask that is, I'm sorry to interrupt you, is
No, you're good.
obviously the baby boomers are getting older, plus
Yep.
I think there's probably, I'm just gonna, my personal thought is there's probably less people insured now than there was 10 years ago.
There are generally,
Okay.
and I think the next slide's gonna give us a depiction of your payer mix. I wanted to take a look at
Okay.
that, because what we do see, LifeQuest bills for 270-plus services across 20-some states in Guam, so we get a very good imprint of what's happening nationally, and absolutely, private pay is on the rise, you know, these high deductibles and stuff, and folks that even have insurance are left with these. We thought Obamacare or balanced budget, you know, we thought, wow, in the business, everybody will have insurance now, right? Never came to fruition. So we do see generally across, but I think your numbers depict that just a little bit differently. I think your commercial, you know, was on the rise. And obviously, if we could pick our business, the people we transport, we'd want to transport people with commercial insurances, right? Then probably Medicare, then probably Medicaid, and then private pay. But I think that'll be depicted on this
Okay.
on this next screen here, if I'm not mistaken. Gosh, here it is. So this just looks over 2012. So from a private pay standpoint, if you look at this purple line, it's actually on the decline from 2018 to 19, which is interesting to me, because that's not the norm that we see across the nation. So I don't know if industries had a little bit of a boom here, or people are a little bit more just have access to the health, you know. Some of it is the access to the exchange and such, but generally we see private pay just continually climbing. Interesting too, your commercial insurance, last year, the red line there, you can see it kind of started to dip, but now in 2018, all of a sudden, boom, more people in 2019 that were transported. Now, it could just be luck of the draw that the folks you transported had insurance, right? But it would tell me something about the area, and I don't know if industry or something, or the availability of insurance has been a little bit more prevalent, but actually that's on the rise a little bit. Now, maybe it'll take a dip in 2020, let's hope not, but that's the bucket we definitely would like to do business in, is that commercial. Yes?
Who, I guess, gets Medicaid versus Medicare?
I'm sorry?
Who gets Medicaid versus Medicare? Like,
Who?
yeah, who? Like,
Well, I mean, folks, obviously, you know, depending on their incomes, are whether or not they're eligible for those programs. And so once they, you know, have that as a benefit, if they're transported, of course, by the service, then we would bill Medicaid in those instances.
because I guess I think of Medicare as if you're 65 or older, you get
Yep.
Medicare, but Medicaid is based on income then?
Yep,
Is that how it's
Medicaid is based on income. You can, you know, folks, you know, 18, 19, 6 years old, 5, 6 years old, oftentimes if a parent is covered under MA, they're also covered under that. Now,
Is that Badger Care? Is that the same?
it is, that's just one form of them.
Okay.
There's actually, I think, 127 different variations of a benefit of MA. There are all kinds of programs that are administered by private health insurances, Network, you know, Humana. They all sell these products in the state. Ultimately, like I say, has about, I think, 127 different variations of that coverage. So yes, it's based on income for Medicaid.
Okay.
Medicare is similar. It's primarily age, although you will find folks that are, you know, 20 years old, have certain conditions, they do get
Sure,
Medicare
if you're
benefits.
disabled or
Yep.
something, right?
Yep,
Okay.
yep. So things that impact revenue, rates, right, the city's rates. As we saw from the fee schedule, we saw that Medicare was paying us $432. So as long as you charge over $432, you're gonna get the $432, right? So sometimes councils will look at things and say, well, let's up our rates, we need more revenue. You should see some difference in commercial insurances and in private insurances, but as we apply that, so your rates now are $11.50 for a non-resident, you only get paid $430. So even if you charge that to $2,000, you don't get any more money, because you're already getting the max that they allow. So you can adjust rates. You just have to understand you're gonna have more adjustments every month, right? It's just a mindset. Again, where you'll see the difference, hopefully, is in commercial insurances and private pay, right? Private pay, sometimes it happens through the intercepts and stuff. When it comes to rates, we do rate surveys. We kind of keep an eye on the businesses around you and the services around you, and understanding it's not competitive, but it gives you the opportunity to kind of see what other services are charging, and I think we sent that back in November, if I'm not mistaken. And we give you a recommendation on what we feel are comparable rates based on the services we survey. So it's not based on, you know, like your expenses. We obviously don't know what you're paying for staff and ambulances and equipment and, you know, all of those kinds of things. But those recommendations are simply based on the area rates of services in and around you with comparable levels of care. You 100% determine those rates. You can say, yep, I approve this one, disapprove this one. That 100% comes from the village. And I just made a note that those new rates we did get that were approved and came up. They've been in effect since December 2nd of 2019. So you'll certainly start to see some increase, not in Medicare and Medicaid, right? You're going to just see increased adjustments, but you will see a shift from commercial insurance and a private pay. So obviously the other thing that we just went over is your payer mix, right? It makes a big difference. If we come into an area and you've got 45% commercial insurance, I can tell you, you're going to have you're probably not going to make money anyhow, but you're going to have a lot more revenue coming in versus when we come into an area and you've got 75% between Medicare and Medicaid, right? We have to take what they do. And obviously the business that you get involved with. You know, obviously most services municipalities are involved in the 911, providing that coverage for their communities. But the interfacility business is where a lot of services have ventured into that market because it can be a more lucrative. It definitely can add to your bottom line. Obviously there's costs of providing that service, and that's something you folks evaluate, but that certainly would change your revenue. And bundling charges, which I believe you do. So a lot of payers are, because Medicare and Medicaid only pay us for the base rate and the mileage, that's what other commercial and private insurances want to pay. So oftentimes if we bill it to, you know, network or something, they'll deny it and say, you know, we don't pay for disposables. But if it was lumped in the base rate, they do pay for that. So I think we've made that recommendation. You've approved that, which was a very smart move because more and more payers are refusing to pay for disposables, drugs, those kinds of things. And of course, the insurance is usual and customary. When you bill to commercial insurances, they have their own usual and customaries that they oftentimes apply, right? And it's based on that particular subscriber's plan. So when we bill them, they pay according to that, whether or not there's a copay, deductible, or there's a balance. Oftentimes they raise a little trouble in our industry because they'll tell the insured, you know, we think that's higher than usual and customary. They certainly won't give you their calculations on how they come up with those numbers. So we battle that. The bottom line is unless the village and you don't have agreements with insurances, we do balance bill patients if their insurances do apply to usual and customary. And then documentation. It 100% drives reimbursement. 100%. We have to look at a run and from the cruise documentation determine whether or not this trip was covered or not, because for Medicare and Medicaid, we bill Medicare Part B benefit with CMS. It's a transportation benefit. We literally get paid to transport people. The level at which we get reimbursed is based on the level of care we delivered, but first and foremost, it's determined by the cruise documentation and whether or not that trip justified the need of that transportation in the ambulance. So I think that's probably all I have. I know you, again, have an ambitious schedule, but I'm sure you might have some questions. I'm happy to answer those for you.
Do you know how long LifeQuest has been providing that service for us? I know it's been a while.
Oh, Lord, I should have brought that. I think since like 2009 or 10.
Okay.
I think that's close, and I'm sorry I don't have that exactly.
Are
I
there
can
any
certainly follow up with
services?
this. What's that? Yeah.
Are there any services that do their own billing, or is this the norm typically?
It's definitely the norm for most services to outsource. There's, you know, a lot of complexities, you know. I mean, it's not that rules change every day, but you certainly have to watch different things that are happening in terms of the bulletins. The real issue for services internally is generally, you know, you never want to have the same person that enters charges post payments. So now you've got a couple different positions and postage and things like that. And with the rates the way they are and stuff nowadays, it's pretty hard for services to do it internally, but certainly there are some. We'll occasionally have a service that'll say, hey, we wanna try it. I would tell you that most of the time they come back and say it didn't work, and now we have somebody on our payroll that we're trying to find a spot for or something. But you know, there are some smaller volunteer services that's more prevalent where they've had some gal that's been with the service for 25 years that does her billing, and until she's ready to give it up, that's kind of how it works, quite honestly. But most municipalities of any size and structure outsource.
Okay.
Yeah.
Thank you.
Yeah, absolutely. Great question.
Could you briefly just go over the write-off process?
Sure, so when it comes to, when we talk about these mandatory adjustments, when we get an EOB from Medicare that says, apply the $432 to the account, and we see the explanation does the mandatory, those are automatically done without any approval, right? That's part of our contractual arrangement with the village, that those are automatically done. We don't need you to approve those, because they have to happen. When it comes to hardships or any other discount, those are always 100% at the discretion of the village. So if we have a patient, our goal, of course, is to get payment in full for you, right? And so if we have a patient, for example, in a scenario where they don't have insurance and they call and they say, we'd love to, pay our bill, but we gotta make you payments. We set up those payments, it might take them a couple of years to do it, right? That we try to work with people to get those taken care of. But let's just say they reach out to us and say, I would love to pay the bill, I just absolutely am tapped, I have $0. If they kind of present like that, we do, say if you're saying you can't pay the bill or you want to just ignore it, we have hardship forms, they fill those out, we evaluate them based on the poverty income levels. We'll make a recommendation back to the village to say, hey, we think you should make a 25% discount, 50, 75, maybe nothing. But you ultimately make those determinations. If we get an issue where maybe somebody calls and says, a lot of people say, well, I never called the ambulance, right? We sort through those kinds of things. But if somebody was to obviously, identify maybe they feel like they were neglected or something like that, we're obviously gonna reach out to the chief. And maybe there's a situation or two where it comes up where, and I can't think of one offhand that the village has done, but if you were to ever direct us to say, hey, we just want that bill, maybe there was something happened on the call and you're like, we just want to forget that debt for something, we just go on and make those. But again, those are always directed by the village.
How about though, just if there's a phase write-off too? Is there like a, if people don't pay after a certain amount of time, and then there's some even when the patient dies, maybe
Okay.
years after.
Yes,
It's a process
yes,
that-
absolutely. So we're set up under a billing, and because we also do your collections, we're a licensed collection agency, so we work the accounts in billing, and once they become delinquent, they transfer them, they get closed out in billing on your month-end reports, they get added into the AR of the collection process, and they do that. Now, some people think, well, of course, LifeWest is just gonna run them right through the process. Obviously, we've probably been out of business a long time ago. I actually was just looking, and about 90% of the money that we collect for you gets collected in the billing phase, right? The collections or the delinquent accounts, it's a very small piece of what we do, but it's a nice to have it in-house like that because we have the history. And the good thing is let's say somebody ignores their bill for 120 days. If they completely ignore it, after 120 days, it goes into our delinquent accounts. And then they get the notice that, yep, you've now been turned over to a collection agency, right? And then they call and they say, I have insurance, right? I don't know why they do that, but occasionally that happens. We have the availability to then send it back to our billing department, get it billed out on the correct HCFA 1050 form to get a claim sent to the insurance so they pay, because most insurance won't pay. Once it's been in collections and they don't pay, if there's an open balance, we endure the cost of putting that on their credit report. We also file that with the tax refund intercept process, intercept program. So that's kind of like Plan B working always behind you. They're still on our dialer, they're still getting notices, but we've got it filed back here with the tax, so you probably understand that program where you get a refund from that. Now, if there's anything statutorily like a bankruptcy, that requires us to write it, or it's past the statute of limitations, which I believe is 6 or 7 years here in Wisconsin, from the last time they notified us. So if we have to mandatorily write them off for that, those adjustments are made. They're always on your reports, but anything that's other than mandatory, the village always makes the call on that.
Thank you.
Yes, thank you.
Any other questions for
I
Jen?
have a question.
Yeah.
Can you go back a couple slides
You
with
bet.
the total billing, gross billing, mandatory adjustment?
You bet.
This is those, so it's 627, if I back off 265 and 246, I get 115. So can you tell me what that is, I guess?
So the balance of that, okay, so we charged out, if we're looking at 2018, we charged out in original charges on new calls, right? $627,000. We had brought in revenue throughout 2018, cash, that represents cash, 265. The mandatory adjustments of the 246 are, of course, them that don't. The balance of that account, so we're at, you said 515 or something? Yeah, so the balance of that's going to be calls that are in commercial insurance schedules, private pays, time payments. There's lots of different scenarios that those could be. It certainly could be folks that have no insurance, but but that's gonna be in our AR.
They're all in collections, right?
Well, not necessarily. Some of the balance of that account might be folks that didn't have insurance and they set up a time pay. And now they're paying, $50 a month or something until they get their bill paid off or something.
Okay.
Could be that. It could be calls that have aged past 120 days. It really depends on the activity or the inactivity of an account. Like I say, someone could set up a private pay or a payment plan and they pay for a year and then all of a sudden they just stop paying, right? And then we reach out to them and say, hey, you missed your payment. And if they don't pay in 60 days or restart those, then they're gonna go to collection. So, but if someone just completely ignored their bill after 120 days, it goes to collection. It gets to be a point where we wanna give them an opportunity to pay, but we wanna also ramp up the efforts and say, hey, look, this is your responsibility. So, yeah, those will be commercial insurances, private pays, time payments.
Do you know
things like
what
that.
percent of stuff you send to collections you get collected?
Yeah, it's roughly around 15%. Just, that's a very rough, and I mean, I'm happy to look at it and tell you. I can pass it on to the chief as well.
Sure.
Yeah, but it's roughly around 15% for most services.
I guess that's lower than I would have expected, but I know there's a lot of.
Well, I like to think because we do a good job from the billing aspect. Like I said, 90% of what we collect for you is gonna be collected in billing. So I'm confident that, we scrub that stuff, we find what we need to find so that we do it up front and later, we're really like, that's just people not paying their bills,
So, along those lines, you said 90% of what you collect for us is done through billing. When the scenarios you were just talking about, the commercial insurances that's going through the commercial insurance, not showing up here right now as gross revenue, would you consider that through the billing process?
Right, well, yeah, some of this could be commercial insurances. Well, definitely, some of this gross revenue is from commercial insurances, but it may have been like billed to a commercial insurance and they applied it to a copay or a deductible, so now the patient's making payments. Part of that balance.
And I think that's brings in the challenge trying to budget this, and, I've said 46%. 46% may be more accurate when you start, after a number of years, and you start getting some of that uncollectible back in.
Right.
But if you look at year-end data, it's not very accurate, because there's still a portion of that that's going through.
That's correct.
Collections
Right, yeah, it's
or
always
billing and.
kind of cyclical, right? What we're billing today, we'll probably collect next month.
So it's kind of,
Yep.
you almost have to make some assumptions at the end of the year, and I think that's where we settled in, Chuck, over the years. I think you started with that 46, 48%, and, until, you almost gotta look back 3 years to see if you were right.
Right,
It's.
I can tell you that services across the country treat bad debt, a lot of them treat it differently. Some of them are kind of says it's off to this side, and by gosh, if we collect any of it, we're happy, right? Some it's part of their AR, every municipality does it a little bit different, but.
Can you refresh that 2018, like, is that as of today, like how much you've
So
collected?
those numbers are not gonna change.
Okay.
So that takes a look at what was billed out in 2018 and what was collected
So if you
in
collect
2000.
it later, it won't show up on here.
Correct, so these original charges that happened like by date of service in 2018,
Yeah.
you have a call in November 1st of 2018, you might not, depending on who it is, if it's VA, it's 180 days to pay. So it's 6 months later, we're gonna get that payment, right? Most payers, Medicare is about 14 days, Medicaid's about 30, most commercial payers are about 45 to 60. So, right, you know.
Sure, so this
we-
is missing some payments.
Certainly,
Yeah.
certainly.
But do those
certainly.
then, like, let's just say, for instance, if those were in 18, like we just spoke of, they didn't get paid, but they got paid in 19, are they showing up in that 19 gross?
Right, they'll be part of this number.
Oh,
So certainly,
yeah.
some of this money, so in January, like right now, we're probably getting payments. Most of the payments that are coming in right now are from 2019's business.
Sure, I guess I was thinking you didn't show them anywhere, but you show them in the next year.
Yes, right, they're always just in, as the payments come in on a monthly basis, those reports are made available to the village and whoever has access to those, but, right, you're getting paid today probably for what happened.
Does that scenario also include the collections?
It does.
Those also hit the account whenever the payment
Right,
comes
it's
through
whenever the
collections.
payment is
All right.
made in that particular month, they're part of that month-end's report.
So in this case, Jake and I had talked last week, we had a very large December billing and a lot of transports, but probably won't be reflected until
Probably January. If we
January,
looked at-
February,
Yeah,
right?
if we
So-
looked at January this month, we would probably have a good month. Yep, if you had a big December, yep.
Can you show me what the pay schedule is for transports?
I'm sorry?
Transports, are those different than emergency calls? And
Correct,
what's
yeah.
the billing for that?
What the rate is?
Yeah.
Yeah, I think we have that, right?
Is it on yours?
You're charging differently for your interfacility business, yeah. Gotta get my
Because
glass.
Medicare has a rate for transports then?
Nope,
and it's-
they pay according to that fee schedule, doesn't matter what kind of business you do. So if you do an interfacility transport,
Yep.
you could take them, well, you get paid per mileage,
The mileage
loaded
you still
mile,
get.
but the base rate's gonna be the 432, assuming you were billing at that ALS level.
You called it, what makes it an ALS call?
So in order for it to fit at the ALS level, you have to have an ALS provider on the call, which you do, right, by your staff. They have to be IB techs or higher, and they have to have documented on their care report an intervention, an ALS intervention or assessment.
So
And
that
it-
wouldn't be a transport would not be ALS because you're not doing intervention?
Yes,
Necessarily.
well, but you're doing an
Though?
assessment.
Yeah, we're doing an
You
assessment.
do an
so we can
assessment on all your
do
patients, you should be.
ALS1,
Yeah.
and then
Yeah.
also it can be based off, if we take let's say we go from Aurora to Milwaukee,
Mhm.
and the patient needs some sort of pain medication or something,
Yeah.
or monitoring a IV line or something of those sorts, that would be considered ALS.
So what is the rate for that? That would be the same as this
$480.
$482?
Yep.
Well, I show your interfacility rates. If the patient was cared for at the BLS level at 600,
I mean the Medicare rate though.
the
I was-
Medicare rate's that fee schedule. That never changes.
Can I see that again?
Yeah, absolutely. So when it doesn't matter if you're doing a call in the 911 setting or you're taking elective interfacility business, this allowable table applies. So if you took a service, from here to Duluth and the documentation supported that patient had to go to Duluth,
Yep.
you're gonna get paid $7.55 for your mileage. That's where you make but you're only gonna get one of these rates depending on the level of care that you provided during that transport.
Because you mentioned that, I guess, you don't make money on ambulance, but if there's I guess, a better ability to make money on interfacility transfers. Why do you say that then?
Well-
Because it seems like it's the same fee schedule,
It is, but you generally make it in the mileage.
because you usually drive
Yep.
farther.
You do try,
Yeah,
but
we
again, it has to be
very
covered.
rarely take transports that are less than, we can figure out the mileage that we average in 502, but, they're 40, 50 miles.
Okay.
So, that's where you make a large chunk of the money that's guaranteed, essentially.
Yeah, and it's in volume too as well. If you take an awful lot of interfacility transfers, I think the whole thing is you have to look at your business and, what your staffing configurations are.
Yeah.
Because in order to provide that, you have to have those folks available. But generally, services that are looking for added revenue, and quite honestly, a lot of the private sector, that's the business they're in. They're in that business, taking them back and forth to dialysis, wound care clinics, things like that. Now, if you're just kind of dabbling and taking a few transfers here and there, it's probably not gonna make an overall difference, of course. And then, of course, somewhat being selective. If the hospital calls you and all you take is their private pay, that's probably gonna be a tough way to make a go of it, right?
Does the Medicaid, I didn't notice, did that also have a mileage number?
It
on
does,
that?
it's 5 something,
Okay.
556, yep. Yep.
Interesting.
It is, it's a little frustrating, to be honest with you. Our industry has really been plagued with, and I work as a critical care medic and have for many years, but it's been a real challenge for a lot of industries, and a lot of services, and and the reimbursement doesn't get any better, so.
I guess, how do private ambulances make
They
it?
do it in the interfacility. They do it in volume and those transfers, you're taking, I don't know what your average transport mile here, I'm guessing 5 or 6 miles is your average
Yeah, for
call.
911. Yeah.
Right, so you get into the interfacility and you start taking people, from like rural, a lot of in rural settings, they don't have the services available, so they have to go to a hospital 40 miles away. You start getting 40 miles racked up on every call at, $7 or $8,
Sure.
I don't wanna make it sound like it's a windfall, but it does help offset costs in some instances.
Yeah.
Now, you gotta be getting paid for them too, right? Like I said, there are situations across the country where that's very competitive. You've got 3 or 4 services fighting for that interfacility business, And, you know, if you don't have a good relationship with the hospital, maybe they call you for all the private pay, right? You know, like, hey, they're not gonna get paid for most of them, and they call the preferred service for all of the ones that are commercial insurance. That does happen across the country. I'm not suggesting it happens here, but, it can be a real stickler, yeah.
It's interesting.
Nice.
Do you help set the rates for, like, say, our per capita we charge for other
Yeah.
communities? I mean, do you give a recommendation?
We do not get involved in that at all.
Okay.
Nope, if you were to reach out to me and ask me to give some advice, because we have lots of, obviously, services that ask us to get involved, but we do not participate in that unless, and really, quite honestly, I don't know your overall expenses. I don't know what you're paying for rigs, I don't know, you know, those things, but I can, we certainly can give you like sample contracts to have relationships with different townships, if, you know, and things like that as you look at cost and things like that. So we can help you to some degree, and, but we don't traditionally get involved.
What do we charge now, 28,
24. I had
24?
26 now.
26
One
now.
up, $2, right?
Yeah.
26 is?
Yeah.
Yeah.
Well, City of Falmouth, like 40 some, right?
What's that?
City of Falmouth, like 40 some, right?
Yeah, they're close to 50. They're either at 50 or 52 or
I
something.
think they're 52.
52, I think.
When they were 40, when they were 40, they used to charge 20
Mhm.
then.
Yeah, it's wide open across the country. We have some over $100, you know, per capita that we find out, and some that are, I don't know how they make it, but
Do you know what the state average is now?
I don't. There is no repository that I'm
Yeah.
aware of that has that information.
It's hard to find.
Yeah, yeah, it is, it sure is.
Does anybody else have any questions for Tim?
Well, thank you. We appreciate the partnership we have, and always hear these guys are great to work with, and if you guys don't mind, we're gonna sneak out.
Absolutely.
Thank
Thanks
you
a
so
lot.
much.
Yeah, thank you guys.
Thanks
We
for
appreciate it.
coming.
You can just have that flash drive and
All right.
that stuff.
Sounds
Okay?
good.
You got what you need?
Awesome. Thanks,
Thank you.
Tim.
Thank you.
Have a safe drive. I'm sorry.
You asked the question, you had asked the question about when did we switch?
Dana was.
Why did we, well, we
Or
switched
actually-
Yeah, you're
before,
good to go.
we switched before Dana
Yeah.
was even here.
Oh, okay, I thought it was.
It
after.
was,
Okay.
when I was the director.
Thanks,
we
Lizzie.
made the switch, because what they found up in front office, and I cannot tell you who the billing person was, but with these mandates that Tim spoke about, it was difficult for them to keep abreast of all these changes.
Rules.
Okay.
And that's why they elected to go with a billing service. And that's, I think it was before 19, I think it was before 2009.
Okay.
I think it's been quite a few years.
Okay. Thank you. Randy.
But
I'm sure he'll get back to me. He's pretty on top of things, so I'm sure he'll get back to me with the.
No, I was just curious.
Yeah.
Not a big deal.
Yeah.
And Jake, thank you for setting that up. Appreciate you.
Yeah,
doing that.
definitely.
That was really good.
Yeah,
Hopefully everybody
Randy
enjoyed
for the
that, got something out of
suggestion.
it.
That was a good suggestion that Randy had to bring him in, because
Yeah,
that was
appreciate that.
very beneficial to me too. It's good to see that stuff and see why it's a challenge. I mean, it really kind of spells out why it's a challenge, so.
I don't remember having that before.
I mean, we reduced our rates for our transports, right?
Correct, yeah.
Have we seen some uptick at all?
Yeah, I mean, they're
Yeah, so
more
good-
steady, you know,
good
it's,
December, I heard, but-
yeah, November, December were pretty good, and, a lot of that honestly has to do with Aurora. They've been calling us very frequently, and saying us has been utilizing the service as well, but, there's been a large uptick from Oshkosh area hospitals, so,
Jake, I just have one
I'm
more
not-
question.
yep.
Tim was talking about the importance of documentation, and I know you guys, I mean, you preach that, you
Yeah,
understand
yep.
that. Do you guys do like chart reviews or report reviews, and, I mean, are you getting some feedback from, them, LifeQuest saying, hey, you guys, maybe you're missing this, and things like that?
Yeah, so if there's a red flag that gets popped up on their end, we get notified pretty quickly, so we can go back in. We recently we've had issues with ImageTrend, the report writing system itself, and we actually lost one of the narratives on one of our reports, so the gentleman, it was maybe 7 days ago, went in and fixed his report, you know. So they're really quick on finding it. If we go through and complete a report, Adam goes through every single report. for QA. So he goes through and makes sure that everything's documented properly. And before I submit the report, so I actually go through every single report and make sure that everything's demographically entered, and then all of our signatures are obtained from our care providers. So they're checked through me first, and then they go to Adam, he does QA on them, and then after that it goes into LifeQuest. So there's a lot of double checking to make sure that the reports are squared away. The other thing, before we move on, I guess, is, you know, that payer mix, he hit on that quite a bit, and that's a direct reflection of Adam, you know, working with the hospitals and trying to get our interfacilities going from private pays to commercial pays, and that's why you see the uptick, and that's why it's challenging to say whether it's 46 or 52%, because if we continue to see the trend go up in commercial, then that, you know, uncollectible is going to go down, so on and so forth. It also is going to go down with interfacilities just based off the fact that we lowered our rates, so that'll help offset some of that as well. But like Tim had said, with increasing some of those areas, you know, you're going to see a fluctuation in it. So it'll, over the next, hopefully we don't have to change the fee schedule for a substantial amount of time, but that'll give us a solid chunk of information. And as you saw, you know, our call volume increased over 200 runs, you know, 400 in some instances in the last couple of years. So, you know.
If a person has private pay and we turn them down for transport, who picks them up? Who takes care of that? You know,
A van. It depends on the situation. So if we can see that it's medically necessary, then that bill will go through and they'll probably get put on a plan, is essentially what would happen. If it's not medically necessary and they have zero need for an ambulance and they're private pay, then we most likely won't take it. So we have documentation that the hospitals fill out that says whether or not it's medically necessary, and it has to justify why it is. And so there's a entire transfer packet that they fill out, and then we take and scan all that stuff into our report, and that's how we dictate who we take and who we don't. I don't know who takes them if we don't.
who makes that decision if you guys take it?
The crews do.
Okay.
The
Okay.
officer that's on shift that day makes the decision. And there's a algorithm that we pretty much have nailed down now. It, you know, obviously takes a decent amount of time to figure out exactly each little thing that we gotta go through, but we nailed it down pretty good, so,
Good. Thank you.
yeah.
Any other questions on this item? All right, seeing none, we're going to move on to item H, ordinances, discussion and possible action on ordinance 2020-1, ordinance revising section 8.20 of the North Fond du Lac Municipal Code regarding private wells, first reading, so there's no action required. So, do you want to take that one, Darren, or?
Basically, this ordinance, 820, sections 9 and sections 10, were something that was brought up during our sanitary survey by the DNR engineer. The old ordinance referenced the old state code, and we need to reference the new 812 code. And then I kind of worked off of a sample that he gave me, and which combined sections 9 and 10 of our old ordinance all into section 9 of the new ordinance, which would then change the last two sections of that chapter. It's basically what the DNR wants to see in our ordinance and referencing the correct state codes.
Cool. And, Ann?
Can you tell us what the change is, I guess? I mean, how is it different than the old?
Basically referencing the old code of NR 112, the
Mhm.
new code is NR 812.
But I mean, is there any, like I noticed in here it says after 5 years it has to be like, if you can only have it for 5 years, is that the same? Are there other things that are different?
We really didn't do well permitting before, private well permitting, when they were connected to to our system before.
Okay.
So this is what the DNR, the recommendation from the DNR, that the well permit, if it's private, if we have a private system.
Mhm.
They can have a private well, we can't stop them from drilling a new well.
Mhm.
We can charge them a permit fee for that well. They can
Mhm.
have it for, whether it's watering or watering their lawns, gardens, stuff like that.
Mhm.
But it cannot be connected to the potable system. So that is one big change in here is going to be permitting of the private wells that are.
Do we have any in the village that are like that?
I know of two for sure.
And can they only have it for 5 years, or is it?
Well,
They-
then they
they-
have to re-permit.
They can re-permit them.
Oh, okay.
We,
And
we
the
can issue,
NRF
sorry, we can issue the permit for 5 years, and then it has, they can reapply for that same permit as long as the same conditions are met for another 5 years.
Because we worry about it, I guess, tampering with the groundwater. Is that what the
Yeah.
why you don't want people to have them?
Right, a well is an open hole to an aquifer where our water is coming from.
Right. Okay.
Mike?
Why would we allow somebody to tie into our water source? Is it tying with our water source?
No.
No,
It's not,
it cannot have a cross connection to our water source.
And you said one or two have them, what do they have them for?
The one I know of has a large garden, and I'm not sure, I haven't investigated the other one.
Yeah, both of them were town properties that had private wells that got annexed into the village, and at the time allowed to keep their private wells hooked to a garden hose, basically. I know, I've been in one of the basements on Prospect Avenue.
Right.
Basically, it comes in the wall, it goes up, it goes out to outside spigot. I mean, that's the only connection they have to it for water in the garden.
Do we do inspection on those every so often, so they
Yep.
don't connect into our?
Yep, when we do water meter changes, that's always, cross connection is always an inspection report. When we do water meter changes, which is at minimum every 10 years. But this will force a little bit more often.
Right, because now with this ordinance and the 5-year permitting, they're gonna have to test that water too. And then supply us with that key report on that well.
Mm-hmm. And if it tested positive or something, they have to
Then
cap
they
it?
have to treat it.
Okay.
Or they have to abandon it.
Right.
Do they fill it in when they abandon
That's
it?
With a
part of the abandonment part is
Yep.
filling the well.
It's filled with
Bentonite.
what's called bentonite. It's like a concrete almost that
It's a powder that goes in, mixes with water, and turns to a concrete.
Oh, okay.
expands a little bit.
But before they fill the well in, they have to remove all the casing and steel casing, which is
Oh.
usually the top portion of the well.
Mhm.
That all has to be removed back to ground bedrock or whatever the ground material is, and then a company would come in and betonite the well.
Thank you.
Any other questions on this ordinance? All right, seeing none, this is first reading, so there's no action required. All right, need a motion, move down to item I, need a motion to go into closed session.
I can do it.
I'll make a motion to go into closed session. Discussion of a personnel issue under Wisconsin State Statute 19.85, Section 1, Section C, considering employment, promotion, compensation, or performance evaluation data of any public employee over which the governmental body has jurisdiction or exercises responsibility. Item A, IAFF contract.
Could you repeat that? I'm just kidding. Can I get a second?
I'll second that motion.
I got a motion by Horning, second by Price to go into closed session. Can I get a roll call, please?
Horning.
Yes.
Price.
Yes.
Streeter.
Yes.
Stutz.
Yes.
Will.
Yes.
All right, we are in closed session.